Hey everybody, it's John Kadlic from Parallel Path on the latest edition of Trail Talks. Today I'm at Antrim Park in Columbus, Ohio with my good bud, Tip Rose, who's the VP of Demand Generation at CoverMyMed's. Looking forward to today's conversation. Maybe Tip, to get us going, you could talk a little bit about your role at CoverMyMed's and then maybe segue a little bit into who is CoverMyMed's for people that don't know it as much, perhaps.
Well, first, thank you for having me and doing the Trail Talk.
A little cold weather style?
A little cold weather, but it's not raining, so we're good.
We're good.
So my role at CoverMyMed's is I oversee our demand generation team within marketing. And so our responsibility is to drive pipeline for our pharmaceutical sales organization, as well as grow and maintain our network of providers, pharmacists, and payers. And we do that through paid media, digital marketing, search optimization, and events. And why we do that for CoverMyMed's, or what CoverMyMed's does, is CoverMyMed's helps patients get the medications they need. And we do that through a variety of solutions, whether that be our core, which is electronic prior authorization. A lot of people may not know that when you have a script that you need, typically for higher expense drugs, they have to go through what's called a prior authorization, where the payer or the insurance company has to approve that this is medically necessary for them. And historically, that's been a very cumbersome process, which was made up mostly of faxes. So as you can imagine, these faxes are going back and forth, and then it has to be taken off the fax, all the manual effort for the insurance company and the physician. And we digitize that basically to make it super simple and save significant amount of time and overhead for really all the players in the healthcare space. And then in addition, through our network, we have affordability solutions. So most people are familiar with the coupon code you have to get discounts off your drug or your prescription.
Right.
Well, we do offer that, but we also offer an electronic version of that, so the pharmacist can do that right in their workflow, so that you as the patient don't have to worry about, oh, do I have my coupon or do I have to search for it? It gets automatically applied, so you don't have to worry about that, and you can just get the prescription that you need at the best price possible.
Okay. And CoverMyMed's is part of McKesson.
Yep.
Obviously a bigger healthcare organization. We can come back to that a little bit later, but I assume CoverMyMed slots nicely into the overall McKesson solution set. And
it does. So McKesson has a big focus on biopharma, or pharmaceutical manufacturers. Obviously, McKesson is a large distributor of pharmaceutical drugs as well as medical surgical supplies. But where we fit in is providing an option for drug manufacturers to, again, help patients get on therapy, stay on therapy, and afford therapy. And it's a big push for McKesson to get more and more into that space, and so much so that we are one of the 3 operating or reporting units for McKesson.
Okay. All right. Well, I know CoverMyMed's basically, since its origin story, has been very much at the forefront of innovation.
Mm-hmm.
And obviously you can't have a conversation today without bringing up AI, so let's just do that.
Yep.
And just curious about either your perspective or the company's perspective on AI and the role in healthcare.
Well, first I would say McKesson has significant interest and adoption of AI. It's one of the CIO's primary charters, is to incorporate AI into the everyday work environment and operations of Greater McKesson. And within that, we have created our own version, if you will, of local language model, or ChatGPT, as most people know it. And it's really in an experimentation phase right now to see what it can do, how it can do it, can it drive efficiencies, etc. Specifically for CoverMyMed's, we look at it both from an efficiency and an automation standpoint. So how can you use AI to eliminate even more manual effort within the prescription process? So even today, still today in 2024, I think 50% of the prior authorizations are still fax-based. And it gets even more complicated when you think about medical benefits. So not necessarily a prescription, but think about it as I need a device, or I need some type of therapy or specialized drug. It's super expensive. I can't take it home. I got to go to a clinic. And it's much more, moves from your pharmacy benefit to your medical benefit. And so we're looking at AI as a way to help streamline or remove all of the administrative burden in there. And that can be through things like autofill. So there's a litany of forms that a provider has to fill for the insurance company. And so can you automate that using the patient's data through an EHR or medical records, things like that, to flow right into there and remove friction. It also can be, if you still need to do fax, can you do OCR and scan that, and so that it doesn't have to have a people intervention to again expedite that process much more. And then from a marketing standpoint, we're certainly looking at it from a efficiency standpoint, from copy and things like that I think a lot of people are looking at. But we also think there's an opportunity where AI can actually make chatbots interesting and worth it. Because I don't know about you, but a lot of my experience with chatbots has not been the best. And it kind of locks you into a certain flow, and I just want to live chat with somebody. Well, the hope is, or as we progress, that AI chat will come closer to live chat so that you can really use it as a qualification tool if that's the channel that a user would be interested in from a sales generation, lead qualification standpoint. So pretty broad portfolio of AI options that we're looking at, but it's definitely a very exciting time, and I think it's certainly here to stay, and I'm excited to see how it continues to evolve.
We talk a lot about moving from dabbling to doing in AI. It sounds like you're doing a lot of doing. And you're in a field, like all of us, highly regulated, lots of privacy stipulations. So are you just taking your time and being cautious about trying these new things? Or are there some specific use cases that you think are a little bit more likely to lead out?
I think a little bit of both. So to your point, we talk all the time about data rights and how we can use those and what we can and can't do, particularly because we have so many relationships with insurance companies that obviously have a lot of data, and we can't necessarily share that freely. And so it's really looking at what data do we have rights for that we can empower or leverage, but it's also how we can have use cases, to your point. So I think more on the experimentation side is with broader data sets. The use cases that we're trying to pursue more rapidly is around that automation or scanning of documents, because that data has already been approved, and it's much more about how do you digitize it for speed and efficiency than doing something that may or may not be within the regulatory environment that we work in.
Okay. And then pivoting just a bit, so, it's hard to tease apart the discipline of marketing from customer experience, thankfully. But, sometimes organizations still get that a bit siloed. Marketing's over here, customer experience or whatever's over here. I'm curious, how you think about that and the role of marketing more specifically in customer or patient journeys.
Well, I'm definitely a proponent of marketing really being responsible for the customer and having a vital role in the customer experience. And to your point, I have seen a lot of places actually that still very much silo those out. And I think what we're trying to do at CoverMyMed's is really think about that experience holistically between marketing, product development, and sales. And how can we think about that customer journey and even the patient journey in a lot of our models as to how we can improve that experience. And because, as you know, as a patient, when you're on a therapy, or even as a clinician, you're seeing so many patients that you don't want to have to worry about all the administrative elements. You want to focus on patients. And the same thing with a patient. A lot of times we forget that when they need these kind of medications, it's because they have a serious illness or disease, and they're not always feeling their best. And so I always feel like marketing can bring that perspective and empathy in particular. As an example, I heard a great story at a conference. It was a woman who was an expert in the pharmaceutical space and had been in it for many, many years, and she was diagnosed with cancer unexpectedly. And so as she went through that journey, she just realized, even though she was an expert in this space, the difficulties of going through that process and dealing with all the side effects and having to do all the therapies and getting everything approved. And I think it's easy for us in this space to forget that a lot of times.
Yeah.
And I always think marketing should be the group that has the best understanding of the customer and can bring those insights and empathy to anything we do, whether it's a advertising campaign or it's how we help them stay on therapy or ensure that they have adherence or medication management, whatever the case may be.
Well, given your demand gen role, I'd love your thoughts on the media landscape and sort of what's happening out there. All of us included, need to stay on your toes because things are ever changing. And you probably have a little bit of a B2B and a B2C perspective when it comes to that topic.
We do.
So, like, what are you seeing right now? What's catching your attention when you think about the media and how to reach people where they are?
I think it's the last 12 months even has been fascinating. Now, regardless of what side you fall on in the political spectrum, you have to acknowledge that mainstream news media in particular doesn't have the same influence that it used to. And we've seen a significant shift to podcasts, much like this one, or influencers in that space. And you saw that pull through in the actual election results. Yeah. And while, yes, we're talking about it specifically in terms of an election, you also have to see that this is not just specific to an election. We are seeing a continued fragmentation of media and a significant increase in influencer influence, if you will, through channels like podcast or even certainly TikTok. You're even seeing LinkedIn coming out with their own little video snippets, Facebook Reels-esque. And we even have seen that through search volume, where we're seeing search volumes for certain areas shift from the traditional Google platform to things like TikTok.
Yep.
And I think because of that, it makes media strategy and media buying so much different. Because even if you think about TikTok's model, half of their business is about matching talent to topic. And they're almost like a talent agency for influencers. And so that's very different than your traditional media buy, where you're looking at RFPs and with media outlets and whatnot. And it really starts to call into question some of the established media platforms in terms of, do they still have the credibility? Are they getting the audience, etc.? So it's been super interesting for us as we've thought about, particularly for our network growth, where we do focus more on B2C-esque, where we're trying to target nurses, doctors, etc. We're starting to shift dollars, or look at shifting dollars to some of those more influencer-based platforms, just as a test and learn to see if it can drive the behavior that we want. I can tell you that one that we already have tested that has been positive for us is Reddit.
Yeah.
And that's certainly been around for a while, but I feel like it's having a bit of a renaissance.
We've seen the same thing, ironically.
Yeah,
Absolutely.
so last year we tested some stuff with Reddit, and we're increasing spend there because we do see it as a highly targeted platform with our audience that is very active, and we get the pull through.
Yeah.
So I think that's just one example of how it's really changing, and I just feel like it's changing in the last 12 to 18 months much more than it has before, and I even felt like it was changing at that point. And it's only accelerating these days as well.
All right, so are you more shifting money to these new channels, or are you still keeping money in other channels, so it's turning out to be more channels in total? Like which of the two is more of the trend?
Right now I would say we're still maintaining the same budget, but we're allocating more to test and learn, and these are the areas where we're testing and learning.
Okay, so more channels, more tests. So in many ways it's gotten more complex, and
yes,
you gotta think harder about all the touch points and then attribution and all the follow-on things to say, where is this person?
And I think too, what it also does is it significantly increases the amount of content and assets that you need to have. And I think going back to the AI conversation, there's certainly a lot of opportunity there to help scale your content creation and all the assets that you need, because not only do you need different assets for the various channels, but you want to test creative and messaging, and so you multiply all that times 2 or 3 if you want multiple versions, and it becomes quite extensive and expensive if you're using an outside partner to do all those things.
I have a theory that websites are kind of reverting back to historical ways. Like, it used to be a website was this deep place with millions of pages, it seemed like, and content as far as you could see, and then everyone thought that was a waste of time and became much more lightweight. And now I think, given AI pulling content from all these sources and sort of serving it up to you, I wouldn't be surprised if sites get deeper again with content in a very niche-y, very specific way for days on end.
Yeah, I completely agree. I mean, that's one thing we're looking at as well, is how do you create more content to drive organic search interest. But to your point, to me, that's kind of the next area that's looking at disruption through AI. Is Google in particular is still trying to figure out how you provide an AI solution while still maintaining your ad revenue model.
Right.
That is key to their existence. And so far we haven't seen a huge migration to what I would consider more zero-click, where you're getting the answer right there in the
Gemini
SERP
or something.
But you have to think that it's going to happen at some point down the road as people get more accustomed to AI responses, or even completely shifting away from tried and true platforms like Google and into a ChatGPT or other models that provide a different kind of search experience.
Yeah. Well, maybe shifting gears for the final part of our conversation. I know you're really passionate about people development and talent management, and obviously that's gotten a lot harder post-COVID with distributed teams, and you're part of a big organization on top of it. Big organization, distributed teams, can't see everybody eye to eye in the office every day like the old days. How do you think about operating in that environment as a leader and a manager, making sure you and your teams thrive?
It's definitely a challenge, but I would say if you look at all the research so far, you do see productivity maintaining or even increasing in a hybrid or remote model. But I do think there are certain times where you need that in-person interaction. And I've always said, kind of as we got into COVID, that I thought the model had already been proven with, if you think about field sales, where they're out in the field, in their territories or regions, however they're structured, and they're not in an office. They're interacting with customers, but their teams come together in person at certain times, like a sales meeting or a quarterly business review, and that gives them the opportunity to interact with each other, build those relationships in person, and ideate in particular times. It doesn't need to be all the time, but there are certain times and where we feel like that's super important. Like if I think about annual planning or campaign development, and you can't do that all the time, but what we've really tried to do is create a calendar where it's understood that at these important points in the year, we will come together as a team, whether it's marketing or broader, and have an opportunity to whiteboard or work session through some bigger problems or opportunities that we see. And then the rest of the time, the team can be dispersed and you can use all the tools that we now have, whether it's video or messaging, etc. Even we've started to use some virtual whiteboarding. I think tools like Figma certainly help for collaboration and in a creative space. And so we'll continue to do that, but we'll also look for those times to bring the team together because we do think that's important to drive innovation, opportunities, etc.
And if you were a young person in today's environment trying to build a career and get ahead in a lot of ways, do you have any words of wisdom for that person?
I tell people, I would say two things. I think one is, and I was just talking to a friend of my daughter's who's in college, and she's looking for her first internship, and I told her that first and foremost, I would be very clear about what differentiates you as a person. And even if you think it's what everyone would say, like I'm a people person, that's okay, as long as you think about 2 or 3 examples that back that up, that support why you're saying that are specific to you. Because I've done a lot of like MBA interviewing and undergraduate interviewing. I was on the committee at both Cardinal and Nationwide, my previous employers, and honestly, that was a huge separator. When someone came in, really knew themselves, knew what they were good at, knew what they were interested in, and had a very clear, almost like an elevator pitch or positioning statement for themselves. That makes a big difference, and you would be surprised that how few actually have that. Yeah. So that would be one thing, is really having, especially because you're not going to have a ton of experience on your resume, and so you have to really differentiate yourself through your personal brand. And then the other one I always say is start to learn as you start out, really be familiar with the tools. So whether it's Google Marketing Cloud or HubSpot, whatever it is, know those tools, because a lot of people don't. And there's a lot of online training opportunities. And when you start out, you need to have more of a technical expertise. And then as you advance in your career, it becomes less about the technical and more about people leadership and strategy. But to start, I always say, know those tools, take the time to learn them, because that will set you apart really throughout marketing. Because as we get older, we're less and less involved with the tools, right? And we don't know them as well as the people on the teams. And so in today's world where marketing technology is so critical to marketing activity, it's important to have those true experts that know how to get the most out of those investments.
I think that's wise advice, especially if you have gaps in time, if you're hunting for a job, or you have some career low points where you can invest in yourself. So, well, maybe wrapping up our chat here, what's one thing you do for your own personal health and wellness?
I do try to get to the gym multiple times a week, but I also do a lot in terms of now, as we're getting older, taking care of my body as well, whether that's through rest, sleep, or cryo, or like cold ice to reduce inflammation. So those are probably the big things I do. I would also say golf, but that's actually more frustrating, I think, than it is health and wellness at this stage of the game. But
I can relate. It's not the most relaxing thing.
No, no, it's not.
No, I hear you. I've had more and more people talk about the importance of sleep, and I'm no different. I pay way more attention to that now than I ever did before. And I think it's a big deal. And I'm glad there's a lot more focus and attention on it. And you have all the trackers and stuff for people that are into that to give you some more insight into actually how you're sleeping and what are the factors that lead to good or bad sleep and all that stuff. So, well, hey, I appreciate you joining me. This was fun to reconnect and have a chat on a cold day in Columbus.
Thanks for having me out.
Of course. And thank you all for tuning in. It's good to see you again, and we'll see you somewhere out in the trail here again soon. Take care.